I'm Blair. I'm a wellness educator here at Natur-Tyme. We also have another wellness educator. Her name is Sterling. She usually does most of these presentations, thank heaven. But tonight they asked me to do it because she's not comfortable with doing the cancer protocols. So I will be presenting tonight. And I've already taken my rescue remedy. So hopefully I will not be mumbling my words too much. I'd like to thank Laurel, though, and also Daniel and Spencer, who are our tech people, for helping me with these slides, because about the best thing I did was put that border around them. But without their help, we wouldn't be having slides tonight. On a packet, Joey. Sure, I think there is an extra one. Sure. Okay, we have a lot to cover, so we'll get started. First, I wanted to give you a little information that isn't in your packet. There are some studies in there, some information in there. And I even think the slides are in there. But this, I woke up in the night last night and decided must be some people needed to hear this, because I felt like God was telling me to put this in the presentation, which was going to be in the second presentation. So I'm going to just start by telling you about a few alternative cancer therapies that are out there and available. There are several kinds of cancer in particular that we don't have a high success rate with in this country, mainly gastric, lung, melanoma, and ovarian. It's interesting, too, that in Japan, whereas we have a 15% success rate with gastric cancer, they have an 85% success rate because they treat H. pylori, which is a bacteria that lives in the stomach sometimes. So there are lots of things, as much as we like to think we know everything, we don't in this country. So there are lots of things out there that might be worth exploring if you're in a spot where you need to look at something else. So one of the things I wanted to tell you about is immunotherapy, which it's an experimental therapy that takes place at Roswell Park, and I think some other places in the country are doing it now too. Now I say experimental, but I will tell you that 25 years ago, I know a man who had this experimental therapy, and what he did was he had lung cancer, and again, we have about a 15% success rate in this country with most lung cancers, and he went to Roswell Park and had there was like a vaccine that he got. They took cells out of his body, they made a vaccine out of it, put it back in his body, and he was cured and lived 20 more years. And he was about 65 or 68 at the time, and he was well into his 80s when he passed away. It's still, however, experimental. There's also some things like a hyperbaric oxygen chamber, which is available here in Syracuse, by the way. And since cancer lives in a primarily anaerobic environment, the oxygen can really help the immune system. Vitamin C therapy, Dr. Heidi Poots does that here in Syracuse, so we're very lucky to have these two things available to us here. Laetrile is very controversial. It's also known as vitamin B17, or in Russia, I think they call it amygdalin. It basically comes from apricot seeds, although it's also found in apple seeds and raspberries and other kinds of seeds to some degree. I called the clinic in Mexico where they use this, and they use one kernel for each 10 pounds of body weight. Now, we do not sell this particular product. We try to stay under the radar, but it is available on the internet. Apricot seeds are by the pound. I don't know. Oh, okay. But we don't sell them anymore. I can tell you that. 2 to 5 per day are recommended for maintenance. There's also a product called Carnivora, which is from the juice of the Venus flytrap plant, and that's used in a lot of offshore clinics, and it modulates the immune system and has been used successfully for chronic lymphatic leukemia, for chronic myeloid leukemia, sarcomas, and brain tumors, as well as some things like HIV. Graviola, a small evergreen tree from the rainforest, which has been studied for leukemia and lymphoma. Mistletoe, which has been, again, in the news a lot because that's what Suzanne Summers used when she developed breast cancer. And that's homeopathically is known as Viscum album, which is actually its technical name. Polyerga, been used in Germany. It's a porcine spleen extract, which is a glycoprotein, and they inject it, but I guess it's also available in tablet form now, so that's another thing. And I think we're going to find more and more therapies are going to be used to build up the immune system in the future, as opposed to the kinds of things we're doing now, which I think we're going to look back on and think it was very barbaric, the way we treat cancer now with all this. The Polyerga, Polyerga. I'm not sure I'm even pronouncing it right, frankly. And then there's one last one called Rana, R-A-N-A, Pipens, P-I-P-I-E-N-S. And that's also used in Germany for pancreatic cancer. So I would just say explore, educate yourself, because knowledge is power. So we'll get on with the presentation. Hopefully they've got this working for me. Okay. First of all, I have to remind you, I'm not a physician. This information is presented here only for educational purposes. It's not intended to diagnose, prevent, treat, or cure any disease, nor is it a substitution for your doctor's advice. Always check with your physician before starting any new protocol, and be especially aware if you are taking blood thinners or antidepressants before taking any additional supplements. But I would like to give a little overview before I get into the actual side effects as to why we think there might be more cancer today. And there's a lot of theories about it. But 100 years ago, there was very little cancer, and so you have to ask yourself what has changed. And one of the big things is our food supply. Our food supply has become extremely refined. Even when white flour was first invented, there still was some wheat germ in it, there was still some bran in it, because they didn't have the facilities to get all of that out like we do now. So now it's really devoid of all its nutrients. And then on top of that, they usually bleach it. And of course, we have lots of pesticides in our environment. There's way too much sugar. We eat about 50 times more sugar than most of our ancestors did. Even our water supply is contaminated, it's chlorinated, it's fluoridated, which all destroy our probiotics, and 70% to 90% of our immune system is in the gut. We have more long-term stress today. We don't have that fight or flight of our ancestors. It just goes on chronically. Vaccines, I think, confuse the immune system. Again, a big controversy. There are a lot more chemicals today, from our households to our cars, our cleaning supplies, formaldehyde in carpet, that new car smell, as they say, which is really just plastic. And they're actually spraying used cars with this plasticizer because to give it that new car smell, which I hate myself. I always buy used cars so I don't have to smell it. And of course today there are lots more drugs that we use than ever, and they're not required to test drugs. However, 70% of the drugs that have been tested have carcinogenic links, and they include sleeping pills, statins, and antibiotics. This slide is courtesy of Dr. Michael Murray, and the last paragraph, it says, among patients prescribed hypnotics, that would be diazepam, Valium, those kinds of drugs, along with sleeping pills. The cancer, like Ambien, the cancer incidence was increased for several specific types of cancer, with an overall cancer increase of 35% among those prescribed the higher doses. That's a big increase. And this slide is also courtesy of Dr. Michael Murray. Never take a pill that has more side effects than you have symptoms. I like that. So what is cancer? And this is the simplest way I can put it. It's an excessive division of cells that has gone unrecognized by the immune system. So basically, cancer cells don't know enough to die on time. There's something called apoptosis. That means a cell is programmed to live a certain time and die at a certain time, and they just don't know enough to die. The nucleus of the cell contains the DNA, which contains the programming for our body. So when the DNA is damaged, that's when mutations occur. There are lots of things that damage the DNA, including heavy metals and chemicals. But there's a cancer protective gene called P53 that helps protect our DNA. But that DNA can be mutated by a high glycemic load and a diet high in omega-6 fats like corn oil and fried foods that create trans fats. And that can mutate that P53 gene. But some of the things that protect it are just the things you might think: vegetables and fruits, blackberries, cherries, both sweet and tart, black currants, dark grapes, not the green ones as much, watermelon, pineapple, plums, and kiwi, as well as vegetables like celery, parsley, and basil, and probably a lot more. These are just a few that I had seen listed in some studies. And Brazil nuts are also very protective, and I think that's probably because they contain selenium. Brazil nuts are very high in selenium. And some of the protective nutrients are selenium, resveratrol, quercetin, and NAC, which is an amino acid, and acetylcysteine. Inflammation is linked to most disorders, including cancer, and inflammation can be reduced with ginger, turmeric, green tea, antioxidants in general, A, C, E, selenium, zinc, those kinds of things, resveratrol, and lipoic acid. You're going to see a lot of these popping up later, and I'll show you some studies on them too. So cancer often spreads by metastasizing to another organ. So they spread by making new blood vessels. That's called angiogenesis. So reducing angiogenesis is very important. Some herbs that help do this are some of the same ones we've already seen. The turmeric, which is probably at this point in time the most anti-tumor herb known to man. Green tea, there are many studies behind that, along with some of these others: ginger, resveratrol, grapeseed extract, quercetin, magnolia, milk thistle, and even colostrum. Colostrum, I think most of you know what that is, but basically that is mother's milk. That's what a mother transfers immunity from the mother to the baby with colostrum that she produces in the first about 48 hours after a baby's born. Well, this obviously doesn't come from humans. This comes from cows. They do the same thing. Okay, methylation is important for proper detoxification. Methylation is a process that occurs in our cells every day, all day long, and it acts as a switch to activate or deactivate our oncogenes, which are cancer genes. Methylation dysfunction can cause our cells to stop communicating, and then they'll proliferate wildly. Some of the things that help with proper methylation are something called 5-MTHF, which is 5-methyl tetrahydrofolate. I know that's a long word, but basically it's folic acid that starts up here, and it has to get down these steps in order for your body to use it. But sometimes today, because we've had chemicals in our system and various things, it doesn't get to that end stage where your body can actually use it. The gene, there's a defect there. So if you can find supplements with 5-MTHF, that will help you methylate better. Methyl B12 is very available. Jarrell makes one. You put it under your tongue. Very inexpensive. I think 100 caps is less than $10 or a tablet. P5P is, again, B6. Starts up here, has to go down the stages to get to here where your body can utilize it. So that's an important one too. And of course magnesium, which is the second most deficient mineral in our country next to iodine. And choline and something called trimethylglycine. All these things improve methylation. Now, the multivitamin Enhanced Daily contains just about all of those things with the exception of the trimethylglycine. And that's kind of a separate supplement. Jigsaw Magnesium contains the 5-MTHF and the P5P in very small quantities, which is nice to help you methylate. It also contains malic acid, and that helps you get into the muscles better. So if you're having a lot of muscle aches, that's a very good form of magnesium to use. Yes? Yes, absolutely. Absolutely. It's one of the things I use a lot. It's a fairly new supplement for us. We've only had it a few months, but I've been taking it myself. I love it. Okay, enzymes. Cancer cells put a protective film around themselves, so to speak, so they go undetected by the immune system. There are some enzymes that can help break down that film, mainly serrapeptase and pancreatic enzymes. The immune system can then respond better. So the serrapeptase kind of these enzymes run through the system, and they look for debris and damaged cells that need to be cleaned up. The serrapeptase dissolves fibrin and other dead or damaged tissue without harming living tissue. So for that reason, it's also good for dissolving plaque on your artery walls. But for here, our purposes today is to use it for tumors, boils, cysts, those kinds of things, and abnormal growths like skin tags and ganglions. It's also good for pain. You start with a lower dose. You take it on an empty stomach, usually 2 times a day, 1 in the morning, 1 at night. Make sure you take it 2 hours from prescriptions, just because there is a little more potential with enzymes for breaking down your prescription faster than you should. Pancreatic enzymes are proteolytic enzymes. They have similar activity, but the problem is you have to use many more. Whereas Dr. Michael Murray uses the serrapeptase in his cancer treatments, Dr. Gonzalez in New York City uses pancreatic enzymes, and he has for a long, long time. But he uses like 100 a day. That's a lot of enzymes to swallow in a day. You don't have to have as many of the serrapeptase. So let's talk a little bit about the diet, and at my next presentation on November 6th, we'll talk more about the diet, but I did want to get in a few basics. Keep the diet low in sugar and the white flour, the refined foods, because cancer does feed on sugar through a fermentation process. Add fiber to bind with your toxins, and of course some of your best sources of fiber are going to be your vegetables, your fruits, and certain grains like oatmeal, quinoa, and brown rice. You might consider a gluten-free diet just because gluten, the wheat today, has been hyperhybridized, and it has 10 times more gluten than it used to. So people are reacting to gluten a lot more than they used to. Have at least a couple of fruits every day, especially berries and apples. They have low glycemic index, and you will see later that they are very helpful. And when you can, buy organic. And this is one of the things I like to give an example. We eat on our food about a gallon of pesticides a year. I mean, that is a scary thought. And if you think about this, if I poured out a glass of pesticide, poured some in a little glass and said, okay, just take a little sip today. I mean, would you do it? I mean, you wouldn't do it. But when it's on our food and you don't think about it, you just eat it. So if you don't buy organic, wash it all in like a vinegar water, let it soak for a few minutes, and then scrub it off. No, they don't. No, they don't. I mostly buy organic, but the few times that I have done that, when I couldn't find something I needed for a recipe or whatever, I always soak them. And no, they're fine. Actually, you can soak them for quite a few minutes without, you just rinse them good. Like, you're supposed to soak them 20 minutes. Sometimes with raspberries, I don't go that long. Oh. Mm-hmm. Wow, nice. Are they expensive, Joyce? Mm-hmm. Mm-hmm. No. Mm-hmm. Oh, my. Nice. Well. Nice. It's okay. So why buy organic? Yes. Mm-hmm. You know, I never measure. I just dump it in. A couple tablespoons. Yeah. Mm-hmm. As I said, 80% of the pesticides are carcinogenic, and the average American consumes about a gallon a year. There was a study at Mount Sinai that showed that when a large group of individuals were tested for 200 pesticide residues, 90 different pesticides showed up. 90. I'm going to show you the Dirty Dozen, and it's in your folder. It's a list of foods that should be avoided unless they're organic, because they are the highest dozen shown to have pesticide residue, courtesy of the Environmental Working Group. These were tested after they had been washed, by the way. Eating these foods exposes an individual to at least 15 pesticides a day. So only buy those if they're organic. And the top 5, apple, celery, peaches, strawberries, blueberries. Now I have a client who told me he lives near an apple orchard. So one year he decided to count how many times they sprayed the apples. 28. 28. I don't believe that, Joyce. Oh, nice. At the regional market you're talking? Nice. Thank you, Joyce. So now we have the Clean 15, the low pesticide residue foods. And the top one, of course, is onions. And I don't think in my life I've ever seen a wormhole in an onion. They just don't like them. And, of course, avocados have kind of a tough skin. And I put nuts in the same category. Don't necessarily think you have to have organic nuts because they might have more nutrition, but as far as pesticides go, it's pretty hard to get through to the nuts. You notice sweet corn is on there, but do remember that most sweet corn is genetically modified, even though it may not have a lot of pesticides. So that list is in your program brochure as well. So continuing on with the diet, try to eat some wild-caught fish a couple of times a week. I wouldn't recommend more than that because of PCBs, mercury. I mean, it's awful what we've done to our food supply. And if you do eat meat and chicken and so on, make sure it's hormone-free, antibiotic-free. And same applies for dairy. Otherwise, you're going to get residual antibiotics, and you're going to get bovine growth hormone. And bovine growth hormone is another whole topic, but basically it's fed to cows to increase milk production. The residue, as I said, is found in many dairy products, and it's banned in Europe, and it's banned in Canada. They won't even take our meat and dairy in these countries, but yet we're still eating it. There was a study in 1989 in Nutrition and Cancer that linked this to non-Hodgkin's lymphoma, and it's also been linked to lung cancer and ovarian cancer. Beverages. Drink water. People don't even know. People say, what can I drink? What can I drink? Because they're so used to drinking soft drinks. I mean, what did our ancestors? I say to them, what did our ancestors drink? Water. Water, some green tea. But if you don't like the taste of water, sometimes you can add a little Young Living oil, essential oils. I wouldn't use any other oil than that because they're not all ingestible. But you could add a little peppermint or a little seeds or a little orange. I have orange in my water right now because it's very relaxing. I'm not exactly relaxed up here. I might as well tell you that. I don't usually do public speaking. Laurel is the face for Natur-Tyme for that. But she just refused to do this one. Green tea for antioxidants and also has alkalizing. There are lots of studies on green tea as an anti-cancer agent. So avoid the soft drinks. There's too much sugar, and especially avoid those with artificial sweeteners, which is our next topic. Animal studies show, yes, I'm sorry. Orange. Young Living essential oil of orange. Young Living oils. They're organic oils. Joyce is actually a representative for them, but I love them. Mm-hmm. Yes, I should have mentioned lemon. I forgot that one. Has a lot of D-limonene in it. D-limonene, D-limonine. But animal studies show that aspartame can cause brain tumors, and when artificial sweeteners are combined with nitrites, the risk increases. Brain tumors are on the rise, and another possible link is cell phones, which is a whole other topic, but there are some studies coming out of Sweden that you might want to explore. Aspartame is also known as NutraSweet or Equal. It's basically a chemical poison. It's 10% methanol, which is a wood alcohol, otherwise known as a paint thinner, which causes headaches and seizures in test subjects. And I actually have had a client who was diagnosed with MS, and I asked her father if she drank diet soda. And he said, oh, yeah, a case or two a month. And I suggested before she started the medicine, she go off it. She was supposed to start it in 3 or 4 days. I said, go off the diet soda and just see if any of your symptoms go away. All her symptoms went away. All her symptoms went away. But aspartame is linked to several cancers, and especially the brain. But it also is linked to MS and depression and a few other things. Splenda, also known as sucralose. The FDA approved this after only 2 human trials of 23 people for 4 days. They looked at tooth decay. They didn't even look at human tolerance. Migraines and seizures are among the highest reported side effects, but it is linked to bladder cancer. And one doctor told me it's more chemically similar to DDT than it is sugar. There are some natural sweeteners, though, that don't have calories. Stevia, which also is known to reduce the blood pressure, and I can attest to that because my blood pressure tends to be on the low side, like maybe 118 over 68. And I was putting stevia in my morning smoothie, and all of a sudden I was getting dizzy. And I've had that happen when my blood pressure's been low. So I went down to Florida, was visiting my sister, and I hadn't had any for 3 or 4 days at that point, but she was taking her blood pressure, which tends to run a little high. And I said, check my blood pressure, and it was only 100 over 60. So it does reduce blood pressure. So be careful of that if your blood pressure is low, but on the other hand, if you have high blood pressure, then it would be a good thing to use. It also supports the liver to a certain degree. Xylitol keeps bacteria and candida from adhering, so that's a good thing, kind of flushes them out of your system. And so a lot of people like Stevita because it's a combination of xylitol and stevia together. And my dentist also recommends xylitol chewing gum because the bacteria don't adhere to your teeth. So, yes. Oh, really? Okay. Yeah. Do we have those here? Does anybody know? Okay. Okay. Oh, I wonder if there's other stuff in them that I'll have to check. Okay. Thank you. Yeah, okay. No, but I've seen it in some natural blood pressure medicine formula since that happened to me. So nuts are really good food. So, every once in a while we have a bad day where we didn't eat well. We went to an antique show and we had pizza for lunch and whatever. And so at the end of the day, I try to ask myself, what did I do to improve my health today? And if I don't do anything else, I'll go get a glass of Knudsen veggie juice and just organic veggie juice and just drink that. Or sometimes I'll eat a handful of nuts because at least I've done something good for myself. So walnuts, pecans, almonds, macadamia nuts, Brazil nuts, they're all good. But just make sure the refrigerated or fresh from the shell is obviously the best. And that's a good way to eat them because you don't sit and eat half a pound because you have to shell them first. But don't eat peanuts. There's way too much fungi on peanuts. But seeds are good. Pumpkin seeds, chia seeds, ground flax seeds, sunflower, sesame, and, of course, apricot seeds, which we'll talk about a little bit later. Juicing can be extremely beneficial because there's so much more nutrients. You can't possibly eat that much food. If you've ever juiced anything, you can put in, 4 carrots and an apple and, half a pound of kale and whatever. And you just can't eat that much food. At least I can't. So it's really nice to be able to juice and get all those nutrients. Now, granted, you don't get the fiber, but you do get the nutrients. And if you can't juice, either because you're too sick, don't have a juice or whatever, there are some green food powder drinks on the market. I just listed 4 that I kind of alternate among these. The enhanced organic greens is our Natur-Tyme greens. It's enhanced with milk thistle and some probiotics, and it has a whole variety of vegetables and fruits. And same with Perfect Foods, similar. That one doesn't have the milk thistle, but it does have probiotics. The Amazing Grass, which is also organic, and then the Living Foods barley grass. And that line wasn't supposed to be in there. Sorry about that. The cruciferous vegetables are basically the cabbage family foods. They provide a lot of antioxidants, and they help us gently detoxify. They're very, very important. One study showed that 3 servings of cabbage family foods per week reduced prostate cancer by half, and that applies to most cancers. They contain DIM, which is phase 1 detox. Well, it's actually not DIM per se, but it's in that family. Phase 1 detox means something the body's taken in and it's going to turn it into a form that the body can excrete, and then in phase 2 the body excretes it. But it also contain calcium D-glucarate, which keep toxins from unwinding in the colon. That way they don't get reabsorbed into the system. So your top choices that the studies have shown are Brussels sprouts, broccoli and broccoli sprouts, and kale. But all those cabbage family foods are good: cabbage, bok choy, collard, mustard greens. Turnips are also in that family, turnips and rutabagas. Cauliflower, radishes are in that family as well. And of course, you can get supplements with broccoli sprouts and so on. One of those supplements is Enhanced Estrogen Detox, which does contain some DIM, some calcium D-glucarate. They're also available in separate forms if you really need therapeutic doses. I recommend the one from Thorne because it doesn't have any fillers in it for calcium D-glucarate. It also has milk thistle, some broccoli sprouts, and some turmeric, which has 95% curcuminoids. So, yes. Mm-hmm. That I don't know. We'd have to check with the company on that. I don't want to answer that without knowing for sure. But I would think not. I think that it would be okay, because I think it would keep the toxins from being reabsorbed into the system. And yes, that's what you want. Yes, absolutely. Mm-hmm. Sorry, I misunderstood. Okay, so cleaning products are a big source of toxins in our homes. I mostly clean with vinegar and baking soda and Thieves Cleaner, which is another Young Living oil cleaner. But you can just spray vinegar water in your tub, sprinkle it with some baking soda, and scrub it out. And Thieves is wonderful because it kills a lot of stuff, as well as being organic. And also, wash all your new clothes before you wear them. I mean, they're full of formaldehyde, fire retardants, all kinds of stuff. God only knows what's in there. So reducing the side effects of chemo. Now we're getting into the nitty-gritty as to why you really came. So nausea is one of the ones I hear about the most. Probiotics are really important for reducing nausea. But the problem is they're killed by chemo and by radiation. They're also killed by chlorine, fluoride, antibiotics, and even stress. Probiotics have been shown in numerous studies to possess immune protective properties against radiation. And remember, as I said before, 70 to 90% of the immune system is in the gut. And there was a study in Italy, it was published in Nutrition and Cancer in 1997, that showed that probiotics slowed the growth of cancer cells in cell cultures. A study was also published in 2005 in the British Journal of Nutrition. And of course, ginger has been used by pregnant moms for centuries for nausea. And ginger is available now in so many forms. I mean, the fresh ginger root, of course, is the best, and I love it. But you don't always have it in the house when you need it. So I keep ginger tea and ginger juice in the house. There's a little bottle of ginger juice. I don't know if she put one over there or not. I had her put a few things over there that I use. And, of course, you have powdered form. And then there's crystallized ginger, which a lot of people who have digestive issues will chew on a little piece of crystallized ginger after their meals. And the pickled ginger is wonderful. It tastes great. And I have a friend who comes for dinner, and she has issues with digestion. And she'll eat half a dish of pickled ginger. She just loves the stuff. And of course, if all else fails, there are ginger capsules, but I think most of us take enough capsules. There are several teas: peppermint tea, fennel tea, red raspberry leaf tea. All are helpful for nausea. Whey protein powder has actually been shown in studies to be helpful for nausea, and it contains a lot of immunoglobulins. Whey protein powder is very good for you. There are some homeopathics that help with nausea, mainly arsenicum, sulfur, and ipecac. Usually we use a 30C, but in the sulfur I would tend to use a 6C. And of course the medicinal mushrooms like maitake, reishi, coriolus, chaga, shiitake, or a combination of all of those all work really well to help not only with the nausea but also to boost the immune system. So some of the other benefits of probiotics, I just picked out 3 or 4 strains just to give you an idea. Bifidobacterium longum, BB536. A probiotic is good bacteria. It's what you find in yogurt, kefir, sauerkraut, foods that have been fermented, basically. And that's your good bacteria that reside in our gut. But this has been a highly researched strain that suppresses breast and colon cancers in studies. And Saccharomyces boulardii, also known as SAC-B just because it's easier to say, has significantly decreased the frequency and duration of acute diarrhea in studies. And very helpful, by the way, if you ever know anybody who has C. diff, it's great. And also kills yeast and candida. But use a formula with several strains if you can, and alternate them, because otherwise you're just going to keep building up the same strains, and there are lots of strains that have been studied. Albuterol and rhamnosus produce immunoglobulins for the immune system, and especially for the respiratory tract, so they often help people who have recurrent sinus infections and that kind of thing. And Alplantarum has been shown to have anti-tumor effects in mice models as well as anti-flu effects. Pardon me? They're in products, yes. Mm-hmm. But you will find some of them, like Alplantarum is in fermented foods like sauerkraut and that kind of thing, yes. Appetite loss. Now, if you've corrected the nausea, sometimes the appetite loss isn't such a big deal. But milk thistle will often help because it keeps the liver from getting backed up. So that will help with the nausea sometimes. And milk thistle also can help reduce inflammation. Swedish bitters improve appetite and digestion, and they aid the liver a little bit too, so they can be helpful. Obviously, they are a little bitter, but most people don't want them. There are also other digestive enzymes as well as the probiotics that can help. Zinc and B-complex are really important for the appetite, and the homeopathic cell salts, silica and ferrum phos, can be helpful too. And of course, weight loss is another big thing, but if you can keep the appetite up and you're not nauseous, then they all go hand in hand, then you won't have as much weight loss. So, but I do caution you, if you are losing weight, avoid sugar as a source of calories. Drink some of these high-calorie smoothies. I put some recipes in your folder. You can add coconut oil to your smoothies. You can add some flax or chia seeds. You can put some tahini or some kind of nut butters. Bananas are very good. You can add avocado. Later we're going to sample a drink called Help by Chocolate, which has avocado in it, and it's a chocolate smoothie, and it has some greens in there, so we'll have those. You can spread almond butter on bananas or cashew butter. People like to do that. Kids love it. And, of course, you can eat nuts. Loose stools is another thing that goes hand in hand lots of times with chemo. Probiotics, as I said, the SAC-B that we talked about earlier, but just in general, probiotics tend to help. There's a fiber called sprinkle fiber, which you can stir into food or make a drink, and that's very helpful. Red raspberry leaf tea, which we talked about earlier. You notice some of these things keep popping up over and over again. They have more than one use. Electrolytes will help prevent dehydration because that's a big thing with diarrhea. You have to be careful not to get dehydrated. And there are some homeopathics that can help. And these would apply also if you had loose stools from another cause. I mean, if you had a virus and you had loose stools, some of these same homeopathics might help. Arsenicum, chinchona, and nuts are some of the big ones, common ones. Low white blood cells, of course, I see this a lot, and I've seen several of these things help bring them up when I look at their blood test from the first time they come in to the second or third time they come in. Ashwagandha, astragalus, echinacea, picommune 4, which we'll talk about in a minute, colostrum, which we talked about a little earlier. There's something called rabinex, which is from the western larch tree. And then there are some vitamins like vitamin A that can be helpful, and again, the mineral zinc and selenium. LARCH. And of course, chemo brain is another term that people use because they have such brain fog they just can't think clearly because they're so toxic. So the homeopathic detoxifier is good. Homeopathics are great because no matter what medicine you're taking, homeopathics are energy medicine. They're kind of, I describe them as acupuncture without the needles. So they're not going to interfere with anything. So if people are taking a bunch of medicines, that's always a safe thing to start with is a homeopathic. So there is one called the homeopathic detoxifier, which will help, and milk thistle will help. And there have been some studies showing that milk thistle alone has caused some tumor regression, and also has reduced inflammation during chemo. The methyl B12, what we talked about earlier, which goes under the tongue for best absorption. And you can take a bath with Epsom salt and baking soda and just soak for 20 or 30 minutes. It's relaxing, and it'll help clear some toxins a little bit. Make sure you get the thyroid checked because stress can really throw the thyroid into a tizzy. And I speak from experience because 3 years ago I had a brother who died of a Coumadin bleed, and my thyroid just went wacky, and I just thought I was depressed. I didn't realize, all that was going on, but it took me a while to figure it out. And then one day I was putting lotion on my legs, and 5 minutes later my skin was dry again, and I thought, okay, there's something else wrong here. I'm not just feeling down and losing hair because I'm stressed. It was actually my thyroid. But, I was able to wean it back to wean off the medicine and nourish my thyroid back to health, so I haven't had to stay on that. And improve anemia. Anemia, if you can't think straight if you're anemic. I mean, it's very connected to cognitive function. And of course, there's always other nutrients that can be depleted. So a good multivitamin is important. The one we talked earlier with the methylation factors, cofactors, is one of my favorites. And there are brain supplements, too, that I found work quite well, are over on the shelf. There's one on the top shelf called Think Fast, and on the bottom there's one called Brain Balance. The enhanced antioxidants is something, I take one of these every day. It contains resveratrol, a lot of the things we just talked about, resveratrol, I think ginger and turmeric, some CoQ10, grapeseed extract, and I think there's zinc in there, too. And, of course, your whey protein shakes again. Fatigue, big thing with radiation and chemo. Coenzyme Q10 is really important. 100 milligrams would be minimum, but you certainly might want to take more than that. You'd probably be broke before you overdosed on CoQ10 because studies show you can take 1,200 milligrams a day, and it is kind of pricey. So most people use 100, maybe 200 or 300, but very few people take the 1,200. But that's what's been used in Parkinson's studies with CoQ10 with some results. Yes. Ubiquinone. Well, ubiquinone is the typical CoQ10. Ubiquinol is a form that's considered more of an end-stage form. But what we're finding is that really ubiquinol costs more, and it really isn't as effective as they thought because it actually switches back to ubiquinone in the body anyhow. So it goes back and forth. So I don't think I would waste my money on ubiquinol anymore. That's what we used to think was the best. But I think I would just get regular CoQ10. That's what I take myself. Yeah, on the back it'll probably say ubiquinone. But if you find a difference with ubiquinol instead of ubiquinone, then definitely use it. But it is more costly. So you might. Ubiquinone is the regular CoQ10. Ubiquinol is the more expensive form. But check and see how you feel. If you've been using ubiquinone and you switched to ubiquinol and you found a difference, then use it. Otherwise, I wouldn't. The methyl B12, very important for energy, and of course is part of the methylation process, and it helps you think more clearly as well, and it gives you energy. So, as I said, just use the sublingual form though, because B12 is not well absorbed in the gut. The whey protein shakes, you notice how they keep popping up. And if you're vegan, you can do vegan shakes too. There's an energy drink that's put out by Dr. Teitelbaum. He's an MD. That he developed the formula, although he gets nothing from it. But Dr. Teitelbaum had to drop out of medical school because he had chronic fatigue. And this was back in the 70s when no one understood that disorder. And I don't remember what happened, but he had some personal things that happened. And so he has spent his life trying to help other people who have that disorder. And he developed this and gave the formula away to a reputable company to make for him. So I would recommend that you only start with half a dose. And if you are taking blood thinners, be very careful because it does have vitamin K in there. And usually a small amount of vitamin K is all right as long as you check with your doctor and make sure that he is aware that you're taking this formula with vitamin K, and then be consistent with it. Don't take it today and not take it again until next week and then take it 4 days. You've got to take it consistently. The green food drinks all provide energy, and I listed those before that we talked about. L-carnitine is good for energy. It helps get your fatty acids into the cell. And positive energy is a product that contains things like ginseng, bee pollen, royal jelly, and my cancer clients really like that. And I've had a lot of people with fibromyalgia and chronic fatigue like it too. Just be careful, of course, if you're allergic to bees. That obviously would not be your best choice. And of course, ginseng can be used in capsules or as tea. And like we said, correct the anemia either with iron or chlorophyll or some other thing that you need. Many prescriptions block hormones that result in hot flashes. And pomegranate juice is very helpful for the hot flashes. And there was a study published in Cancer Prevention Research that found 10 phytochemicals in the pomegranate that seem to inhibit the growth of estrogen-responsive breast tumors. So it has therapeutic properties as well as helping with the hot flashes. Maca has also been very helpful. It provides a lot of endocrine support. It's adaptogenic. It's restorative. It supports the adrenals, the thyroid, and the hypothalamus. So those are a couple of things that have really helped in that area. Yes. Yes, ashwagandha is relaxing, so I would take that one in the evening. Rhodiola is very good for energy, though. And that's in, both of those are in one of my favorite supplements, again, that I take every day. It's called Adrenal Health by Gaia Herbs, and it's organic, and it has both of those in there. So instead of the morning coffee, I'll have one of those with a little bit of green tea. So this is a very stressful time. I mean, at a time, you have to make these decisions, and you have no time to decide what you want to do. You have to make these decisions quickly. So there's a lot of stress involved. So I recommend to people that they do deep breathing. And so to do deep breathing, I think most people know how to do it, but if you don't, what you want to do is you want to make sure you expand your diaphragm. So when you take a deep breath, you make your kind of put your hand on your abdomen and make sure it goes out, and then back toward your backbone as you exhale. So I recommend people, if they don't have time to sit and do deep breathing for 10 or 15 minutes, do 3 deep breaths before every meal, do 3 deep breaths when you get up and go to bed, and a really good time to do them is at red lights. So, but sometimes just having a few deep breaths throughout the day will calm you down. And of course, sleep is vital, and sleep can be elusive sometimes. Decaf green tea with a theanine capsule. Theanine comes from green tea. So if you take a theanine capsule and a cup of decaf green tea, you'll find to get a synergistic effect, and sometimes that will help you sleep and relax. Melatonin, which not only is good for sleep, but has a lot of anti-cancer properties, which we'll talk about later. Same thing with Relora, because it contains magnolia, but it's very relaxing, and a lot of my cancer clients like that. And remember, calcium and magnesium are nature's tranquilizers. Sometimes I'll just tell people to take a tablespoon of liquid calcium magnesium in the evening, and it's amazing how much it can help people sleep. and sometimes just magnesium, plain magnesium works. A lot of calcium and magnesium supplements are not balanced properly. They have a lot of calcium and very little magnesium, so that should be balanced out. A B complex is good. You can get them in a good multi, but do take that earlier in the day because that can be energizing, but you do still need it to help you sleep in the long run because you prepare for sleep when you get up in the morning. Salt lamps are grounding and relaxing. There's a little basket over there with and I have two at home. One that I leave in my bedroom, and I turn it on either when I leave for work in the morning or when I change my clothes at night, and then turn it off when I go to bed, obviously. And then I keep one in my den where I do most of my work and meeting and that kind of thing. But our air contains a lot of positive ions from electricity and cell phones and computers and all that. And the salt lamps can help turn those into relaxing negative ions. So a lot of people, when they go to the mountains or the lake, they come home and they think, oh, that was such a relaxing vacation. And actually, a lot of it is because they've had those negative ions. You can also buy a grounding mat. I have that, too, which I leave under my computer. You can get it on the Internet. I had the privilege of having dinner with Dr. Stephen Sinatra, who is a board-certified cardiologist, and he travels with one of those mats, he said, and he uses it when he's traveling. I can't remember the name, but if you just put in grounding mat, it'll come up, I think, on the... I don't know for sure. I can tell you which one I have. If you call me, I'll check at home, but I can't remember what it's called. Grounding. It's like if you walk around in bare feet on the ground, you're grounded, basically. But we don't do that anymore because there are too many pesticides out there and, all these things. You can even lean up against a tree, put your hand up against a tree when you're out in the woods, and that will help ground you, too. So, but they recommend about a half hour a day, and sometimes it's hard to lean against a tree for a half hour. Yes. Yeah. I have an article if anybody wants it. I could email it to you or, whatever. So let me know, and I'll be happy to do that. Okay. Thanks for coming. Okay, green tea and theanine. Okay, so cancer cells use something called the P-glycoprotein pump to pump the chemo out, and that's how they get a foothold and become resistant to chemo drugs. That's one of the ways, I should say. And this helps to assure their survival. But theanine helps to reduce that process. So theanine is found in green tea, like we talked about, and you can take it as a supplement as well. And theanine is really good for stress. Hi, Julie. I think we have one more folder up here if you want it. If you, well, it depends what you're looking for. I mean, if you really want a therapeutic dose, I would take an extra supplement. But yes, 2-3 cups of green tea a day is great. Yes. Yep. Yeah. But again, if you do it consistently and your doctor knows, it should not be an issue. As long as the key is consistency. No, you can get decaf green tea. I often buy green tea, decaf for the evening. I have regular green tea in the morning. And if you don't like green tea, they have lots of flavors now. You can mix it with something else. Well, it's not going to hurt you. They recommend 2 to 5 cups a day. But a couple of cups would be good. Okay, we're going to skip some of these because they're pretty specific, and I added some other stuff, so there wasn't really time for all that. So let's move on to neuropathy, which is another big side effect I see a lot. Again, the methyl B12 under the tongue is really important, as are all the Bs, but especially B6, which is in the P5P form, is the best, and the 5-MTHF, which we talked about earlier, being that folate. 5-MTHF also, by the way, is very good for depression. It's sold in a couple of prescriptions. One is called Declan, and I think there's one other. I can't remember the name of it, though. So the Be Healthy has all of those, although I still think you need extra B12 under the tongue. Lipoic acid is really good for neuropathy. The typical dose is 300 milligrams twice a day, but some doctors recommend as much as 1,200 milligrams a day. L-carnitine is good if you've done the first few things and it's not working. You can add some L-carnitine. And again, melatonin, I read in a study, was very good, as is vitamin D, also for neuropathy. So, and if you're not getting a good response, you might want to add some other methylation factors. There's a product called MethylGuard. There are also a couple of homeopathics. One is hypericum, and one is a topical called Poprocin, and those can both be helpful. Yeah. You get that numbness and tingling and the burning in the feet and legs, and that during the fingers or whatever, the extremities. Yeah, usually numbness, tingling, burning. Did it help? Good. That's good to know. Thank you for sharing. Okay, so we talked about melatonin a little bit, but I wanted to talk about that a little bit more because there were quite a few studies showing that melatonin reduced side effects. So in patients receiving melatonin with chemotherapy, there were lower incidences of the neuropathy that we talked about. There were fewer incidences of the low platelets, the mouth sores, the fatigue, and the vomiting. And a study in 1999 showed that melatonin reduced chemotherapy toxicity and inhibits free radical production. A study showed that chemotherapy plus melatonin was given to 200 metastatic patients with chemotherapy-resistant tumors, and the frequency of the weight loss, the mouth sores, the low platelets, the low lymphocytes were all less in those patients treated with the melatonin compared to those who just received supportive care. The tumor response was also significantly better, and there was less cardiotoxicity and less neurotoxicity in the melatonin group. Now, you do have to have fairly high doses of this. I had one customer tell me her doctor told her to take 100 milligrams, but you work up. You know, I've had people tell me that they took 2 milligrams and they couldn't wake up in the morning because they were so groggy. So I suggest start low and work up. Cherry juice is very high in melatonin, by the way, so you get a synergistic effect again, and it's also a source of magnesium. So that is kind of relaxing at bedtime. I think it can be either. Renal toxicity. Some chemo drugs cause kidney issues. Cisplatin, gentamicin, and vancomycin are a few ACE inhibitors that are used for high blood pressure can also cause kidney issues. Some diuretics, especially furosemide, can cause kidney issues. They will show up as high BUN and creatinine on your blood test and a low filtration rate, GFR. You can reduce some of this renal toxicity. First of all, before the damage sets in, you need to drink plenty of water so that you're flushing toxins from your system. That doesn't mean coffee, it doesn't mean soft drink, it means water. To improve laboratory markers of kidney function, there have been a few things that have been helpful. Astragalus, which we talked about, helping to increase white blood cells before, helping with the immune system. Lipoic acid, which we talked about before. You notice how these things keep popping up? Ginseng and the medicinal mushrooms, especially Agaricus, cordyceps, corea, and coriolus. But recently there have been some studies done on a product called Renadryl. Now this is a probiotic, and it contains 3 probiotics, Streptococcus pneumonitis, Lactobacillus acidophilus, and Bifidobacteria longum, with prebiotics, and it showed that it reduced the BUN and creatinine in a 2-month trial. We do have that product. Each capsule contains 45 billion probiotics. They recommend 2 a day. It is not an inexpensive product. It's $50 a bottle for 60 capsules, so that would be a 1-month supply. And I actually had to convince my boss to bring it in because even at $50, there wasn't much profit in it. But she's very good. I mean, Wendy is she really wants to help people. So when I told her the studies and so on, she said, well, let's do it. Okay, mouth sores. You can rinse with salt and water, and surprisingly, that doesn't really hurt people most of the time. Use a good salt like the Himalaya salt or the Celtic salt or the real salt, and mix it a little bit with water. You can also use half and half solution of peroxide in water, but I understand people have told me that one does hurt. But it heals. Melatonin, which we've talked about so many times tonight, is also useful for mouth sores. Of course, your B complex is very important. The probiotics, which we talked about before. There's a homeopathic called Wound Recovery. And this is a spray. It tastes like water. You can spray it right in the mouth on the sores, and that helps to heal those as well. Zinc lozenges. Zinc is very important for helping you heal. And by the way, most cancer patients are high in copper and low in zinc. So zinc is a really important mineral, and it's very deficient in our soils. Slippery elm, which you probably think about for sore throats, but it's also very good for healing those mucous membranes. And DGL, which we use for ulcers, also heals the mucosa. And L-glutamine, which we use for leaky gut, also will do that too. Now, all of that is in your folders. Now, if you're having muscle aches, you can soak in a tub with some Epsom salts. As we talked about earlier, you can take that jigsaw magnesium with the malic acid and the methylation cofactors. And, of course, do remember your B complex, which you do need to take earlier in the day, but magnesium will not function without Bs. So that's why a good multivitamin is important, just to round out everything, because it all has to be in balance. Secondary infections. There was a study in the American Journal of Clinical Nutrition in September, just last month. It showed that vitamin D levels of less than 10 doubled the risk of hospital-acquired blood infections compared to having a level of 30 or more. Now, the normal range on your blood test is usually 30 to 100, so you want to make sure it's above that 30. My naturopathic doctor uses 40 to 50. I don't necessarily like to see it up near 100 either, because we don't know the long-term effects of that, because we haven't used these ranges for a long time. So I kind of like to stay in the middle. So, but if the low is 30, 40 or 50 makes sense. But there are numerous studies showing that vitamin D reduces all kinds of diseases, including lymphoma, colon cancer, breast cancer, and as we talked about earlier, neuropathy. There was a study at the National Institute of Health that showed 1,100 IUs of vitamin D was given to subjects who were 55 years and older for 4 years. They had been free of known cancers for at least 10 years, and there was a 60% decrease in their cancer risk compared to the group taking placebo. That's huge. That's huge. And it's one of the most inexpensive things you can do. I mean, it's a few cents a day. Get your D levels checked and make sure it's around 40, or whatever your doctor recommends, but I would say 40 is a good number. They should be getting D. They absolutely. Well, you know, it's hard to say. You have to go by your blood test. But if you're low, then you'll want to take 5,000 or 10,000 a day to get it up. And then once you get it up, usually an average dose I see about between 2,000 and 5,000 a day to maintain it. But that's from all sources. You know, you get some in your multi, but it's not prevalent in the diet. You get a little bit in fish, you get a little bit in eggs. You know, I mean, it's not very prevalent. So that's why our ancestors always gave us cod liver oil in the winter. I took that growing up. You know, we've gotten away from these things, but they knew intuitively that you needed to do these things. Yeah. That's synthetic. That's a synthetic form. Well, you know, I mean, you can take the synthetic form, but actually, years ago, they had said, don't take too much vitamin D because it's toxic, and that's because they were using D2. But D3 seems a lot less toxic. Yeah. Yeah. It's stayed up. Yes, I found that quite a bit, too. But D2 is covered by prescriptions, and D3 isn't. So sometimes if people can't get it up, I'll recommend they take a little D3 too, if they can't afford to do both, can't afford to do just the D3. Okay, there are a lot of negative antioxidant studies out there. And if you think about it, most of the studies are based on the way they study drugs. One disease, one drug. But, you know, nutrients can't be studied that way because they have to be in harmony in the body. So if you're taking too much of one nutrient, you can deplete another. So if you're taking B12, you need to balance it with folic acid, which is why I always recommend a multivitamin to balance things out. And the same thing, if you took too much folic acid, you can deplete B12. So, you know, doctors give this Deflin but if you don't get B12 along with it, eventually you're going to upset the balance. But this antioxidant controversy is raging, but there are 2 prescription drugs that are available that are a precedent for antioxidant use. One is I never get this pronunciation right, dexrazoxane, I think it is, which is used to decrease heart damage caused by doxorubicin, and amifostine, which is used to reduce the harmful effects of the kidneys from cisplatin. There are 19 studies that represent over 15 different cancers in various stages. 17 chemo drugs were used. The antioxidants were included but were not limited to A, C, E, melatonin, and glutathione. There was no evidence that the chemo was lessened by the antioxidant supplements, and there was better survival among the antioxidant group in some of the trials, and there was decreased toxicity. It was reported in Alternative Medicine Review. There were 50 human studies with 8,521 patients. 5,081 of them were given supplements. The results showed that antioxidants do not interfere with the chemo. Indeed, they enhanced the killing effects of the chemo while decreasing side effects, and they protected normal tissue. Yes? Nice. Thank you for sharing that. That's nice. Hi. So Deb is sending around some samples of our Help by Chocolate, which is the drink I talked about earlier that has the greens and the avocado and the whey, chocolate whey protein, and yeah, it's a smoothie. I don't think so. Is there, Deb? No. No, there's no syrup. Well, we sweeten things with like a tablespoon of maple syrup, real maple syrup. There's chocolate whey, chocolate almond milk, some greens, and some avocado. They taste pretty good. You can hide a lot in chocolate. Sure. Okay. Thank you very much. Yes, in our cafe. Well, I always use our Natur-Tyme brand simply because I know that one comes from New Zealand, grass-fed cows. So it doesn't have antibiotics and it doesn't have the hormones. I don't know about that. I know that it doesn't have the hormones. About the antibiotics, I don't know. Yes, I do too. Yeah. Okay, let's move on to resveratrol. How am I doing on time here? Too bad, I guess. Okay. The Annals of the New York Academy of Sciences showed that resveratrol, which is an antioxidant, by the way, regulates cell cycle, inflammation, proliferation, apoptosis, which is what we talked about earlier, programmed cell death. Cancer cells have to have a time to die and a time to live and a time to die, and they don't know enough to die, so you want apoptosis. Invasion, metastases, and angiogenesis. And the angiogenesis is where the blood vessels help the tumors to spread. So it does all of that. And although turmeric and green tea are the most studied, I think you're going to see resveratrol coming into its own down the road. Resveratrol can also sensitize resistant cells to the chemotherapeutic agents, and that's what you want. It comes from the skins of grapes, and seeds, the skins and the seeds of grapes. You know, we've made all our grapes mostly seedless because nobody wants to chew those seeds, but that's where all the good things are. Yeah. Grape seed extract and resveratrol, resveratrol mostly from the skin and the grape seed from the seeds. Grape seed extract. So the Journal of Experimental Biology and Medicine, there was a study showing that resveratrol alleviated many of the debilitating chemo side effects, fatigue, neuropathy, the chemo brain, and even sleep disorders. I think I need to take more. I didn't sleep well last night.
Yeah, this is not my favorite thing to do, as we talked about. Yes, right, exactly. With or without the resveratrol. So resveratrol works, some of the ways it works, it helps reduce inflammation, so it's good for lots of other things. NF-kappa B is a transcription factor that regulates pro-inflammatory messengers in our body, such as interleukin 1, interleukin 2, interleukin 6, and it helps to regulate those. Turmeric, ginger, green tea also reduce inflammation. Dr. Katz at Columbia University uses Zypomend routinely in his practice, and that contains the turmeric, the ginger, and the green tea are all in there, and I think that's over there too. And vitamin D is also helpful, and so is garlic. Now, curcumin. Turmeric, as I said, is probably one of the most anti-tumor herbs known to man at this time. Among all the nutrients, it has the most evidence-based literature behind it. It appears to be safe in the treatment of all cancers, and it's shown to be non-toxic. And it inhibits the transformation of cells from normal to tumor, which is big. It helps destroy mutated cancer cells. It inhibits the proliferation of tumor cells. It decreases inflammation, reduces that angiogenesis, and again, it has the ability to sensitize for chemo and radiation, the cells. Curcumin, also there was a study published in a magazine called Genes and Nutrition that the dietary components that we choose selectively activate or inactivate gene expression, and curcumin is one of those things that modulates gene expression by affecting our cell signaling. But you know, you can't just put turmeric in a capsule and think you're going to absorb it, because you don't. It's very poorly absorbed. You have to have specific forms of turmeric. If you think about what they do in India, where they have a very low cancer rate, they use curry. I mean, they cook it. It has to be treated somehow. You can't just put it in a capsule and use it. I recommend Mariva. That's the one Dr. Heidi Poots also recommends, because it's 20 times more absorption than regular turmeric. And it's bound to phosphatidylcholine, a component of our cell membrane. And there's another one called Curica, which also has boswellia in it. And that's also another good anti-inflammatory. Curica, yes, that's a supplement. And Mariva, that's a supplement with curcumin, turmeric. Yes. Yes, absolutely. In the Curica? That's right over. It's on the top shelf up there, I think. You can look at the products afterwards. I had them pull some of them so that you could see what some of them look like. Curica, Curica. Russian Choice Immune. In Bulgaria, they did a study in the early 60s. They found that when mice with sarcoma were given Russian Choice Immune, the cancer disappeared within a few days. When they tried to reintroduce the cancer in the same mice, it would not implant. Now, realize, however, that this isn't real life. I mean, you don't find a cancer the first few days you've got it, unfortunately, you know. So, but nonetheless, it still has, I think, value to know that. It does increase natural killer cells within about 6 hours, and if I feel like I'm getting a cold or something, I'll just pop about 10 of these in a day, and usually the next day, I don't have a cold. We do. You better rush. I think there was one left on the shelf after my first seminar. It's a supplement. It's a capsule. Nutricology, I think. But you know, we might be able to get some from the back from Needs if you need some joints if they're not there. You know, we have our sister company that does mail orders in the back of our building. We don't necessarily share inventory, but we can get it from them, and you can purchase it with your credit card from them, not through our computers if it's not in our computer system. This you could, because it's in our computer system. They'll just transfer it over. But we do have other things. It's also been used for Lyme disease, which is another big underdiagnosed disorder that's rampant, I think. And I think really we're going to find out that Syracuse is an epicenter for Lyme. But this is made in the USA now. It was just made in Bulgaria. It's derived from, I thought I had it here, but I don't. It's derived from a probiotic, broken cell. Can't remember which one it is, but it's a broken cell probiotic is what it's derived from. I thought I had a slide on it, but I don't. Yes, because they say that this doesn't really implant as a probiotic. It has a different function the way they have used it as a broken cell. Oh, yeah. Yeah. I just pop them every couple of hours. Okay, peak immune 4 also will increase your natural killer cells and immunity. They've had lots of studies done on this. Unfortunately, it is pretty pricey. We did a small study here, headed by Dr. Kareem Ali and me. We had 6 individuals, I think, maybe 7, but at least 6 with cancer. They all improved, and one man said to me, I don't know what I would have done without peak immune 4. And then another woman who had a lot of small tumors within her body, they all went away. But she still had some of the bigger ones left that had shrunk, but they were still there. But that was, I think it was a 6-month study. Good. I'm so glad. Thank you for sharing that. I think so too. But everybody had more energy and definitely a better quality of life. Yes. It is one of my mainstays. You know, I had to pick and choose what I could fit in here because of limited time and so on. But I don't have information on that. There aren't actual studies on that, Joyce. So that's one of the reasons I didn't put it in the presentation. I love it. It's composed, for people who don't know about herbal aloe force, it's composed of the Cassie's tea, or sometimes called Isiac tea ingredients. It's a liquid, and it's in a base of aloe, and it also has protearco and cat's claw in there. It really is a great product. There weren't any studies on it, which is, as I said, why I didn't put it in here, but I will tell you that I had one woman who had ovarian cancer, and her doctor wouldn't let her take anything when she was doing the chemo, but she had a 3-week break, and she just had her tumor markers checked. And so she said to me, what could I do in this 3 weeks that would really help? So I suggested she drink about 6 ounces of this a day. And she did that. In fact, I think most days she drank 8, she said, but it got unaffordable, unfortunately for her. But when she went back, she said to the doctor, I would like you to check my tumor markers again before we start the chemo. They had dropped 70 points in 3 weeks, which was actually more than they had dropped on the chemo. So even though there aren't studies behind it, I've seen it work. Yes, that's one of the Cassie's tea ingredients. Yeah. Herbal aloe, HERBAL, herbal aloe force. Herbal aloe force is the name of the product. Yeah, it is. It's just overgrown rhubarb. Comes from Turkey. Okay, now again, because a few people arrived late, I am going to give the disclaimer again. I'm not a doctor. This is presented just for educational purposes. It's not intended to diagnose, prevent, treat, or cure disease, nor is it a substitution for your doctor's advice. Always check with your physician before you start any protocol, and be especially aware if you're taking blood thinners or antidepressants before taking any additional supplements. I should mention this. Earlier in the earlier session, Marilyn Edwards is here. She's a registered nurse and a certified social worker, and she's also certified in Healing Touch. And she's trying to start a cancer support group. I meant to put her phone number on here, and I forgot. But you can contact me if anybody's interested in that. I will give you her phone number. I do free consultations, as does Laurel, but Laurel doesn't really like to do the ones involved in cancer. I have copious notes on most of the chemos because I can't keep it all in my head. And if there are new ones pop up, we do research on them. But I do work by appointment. My number's up here, 488-6300 is the main store number. And just ask for an appointment with me. The appointments are free. They're typically a half hour. But sometimes for your very first visit, I will allot an hour because there's so much to go over. And it's really hard to do it in a half hour sometimes. So if you ask for an hour, just tell them that Carol said we could ask for an hour for the first visit, and they will be happy to do that for you. You can also email me at carol@nature-tyme.com. Now I'll take any other questions that we didn't answer throughout, if there are any. Oh. Yes, it was. I'll remember, Joyce. I'll look through my notes and I'll find it for you. But just email me and ask me for the article. I think it was it on the Russian choice immune? No, it wasn't on Russian choice. It was something else. I can't think now what it is. Julie, do you have a question? I wish. They do that in other countries. There was just to give you an idea, everything is led by money in this country, unfortunately. But in Germany, they use a lot of different treatments, and they're integrated. And a few years back, I remember they did a study on Proscar against saw palmetto, and saw palmetto actually won. And in Germany, they sent, because they have socialized medicine, they sent out an email, or not an email at that time, I think it was just a letter to all the doctors saying, okay, you have to use saw palmetto, and if it doesn't work, then you can try the Proscar. But in this country, they tried to pull it off, tried to pull saw palmetto off the market because it worked like a drug. In other words, it worked. And we can't have that competing with drugs. I don't. I have it in my office, though. I meant to put it on there. I'm sorry. Yeah. Yeah. It does have GI symptoms associated with it sometimes, though. A little constipation or diarrhea sometimes, but it is kind of a detox thing. Really. Yeah. And Joyce, if that means getting the low dose and opening a capsule and taking part of it, that's fine. You can tease your body into accepting these things, but when people are toxic, sometimes that's why we were taught start low and go slow. So that's what I always recommend. Even with lipoic acid, although they recommend 600 to 1200 milligrams a day, I usually tell people start with a lower dose, like 300 even, and see how you do for a day or two before you start adding those big doses in. Because it does have sulfur components, and sulfur is, again, if you have sulfation detox issues, then you're going to have problems with it. Any other questions? Yes. Well, that's up for argument right now, especially with this Obamacare thing coming into play. I'm myself not in favor of it, but there are people who are, and they probably have their valid reasons. But I like to pick and choose who I help, and when the government interferes, then you don't have that option. But that's just me. Yes. No. No. I can probably flip through and find it. Yes, that's what it was, the grounding mat. Very good memory, yes. See, I needed my brain balance. Yes. I think you can get it in the grocery store, but sometimes they mix it with dextrose, so you're getting some sugar in there. Okay. lots of, that's a whole topic in itself. Yeah, we carry it. Mm-hmm. And inulin, by the way, is a prebiotic, meaning it feeds probiotics. So in other words, it's food for your good bacteria. They're in there, aren't they? They should be in the folder. Mm-hmm. Mm-hmm. Yes, Julie. Yes, it is. All the slides are in there, and if you have questions, you can let me know. And there are some studies in there too in that file. And some of this will go into a little bit more on the November 6th group. Is going to be I'm Cancer Free Now Watch, and that will have additional information. Yes, the fluorobiotic floss. Renadel. Oh yes, that's fine. That's mostly for kidney issues. Yeah. Yeah, that's fine. Oh yes, absolutely. That's the purpose. Yeah, there aren't any calories in it, or maybe one or something. No. I imagine in other countries, I doubt if here, but in Japan, which by the way, I think, let's see, China and Japan and then India have the lowest cancer rates in the country. And by the way, when I saw a graph one day, China, Japan, and India. So I saw a graph one day, and so over here is China, this little bit, and Japan just a little bit more, and India just a little bit more, and U.S. is way over here, off the chart. And yet China has all this smog, all this pollution, you know? Yeah, I know it. It's amazing. But I know that in Japan, they will not allow, one of the reasons that there's a Pepsi now with stevia in it is because in Japan they will not allow high fructose corn syrup. They had to use stevia or they couldn't get it in the country. So I imagine they have studies in Japan. I have not actually seen them. Oh, yeah. But they eat very little. You know, my son was in Asia, and he said, yes, Mom, they do eat white rice, but they eat a little scoop. They don't fill the plate. They eat a little scoop. And they fill the plate with vegetables and, you know, that's the difference. Absolutely. Lots of minerals if you think about it, because of all the seaweed they eat, and lots of iodine. You know, they're all good. It depends what you're looking for from them. If you're looking more for iodine, you'll want the things like the kelp and I think the adult, whereas I think nori doesn't have as much iodine, but it has more minerals, so, you know, it's kind of a balance again. Oh, I don't think that's going to spoil. No, I don't think so, because it's dried. Yeah, that's probably why. Any other questions? Thank you for coming. Yeah.